Hello, my name is Wesley Bugg. I am with Reaching Our Sisters Everywhere and Reaching Our Brothers Everywhere, calling from Decatur, Georgia. Offices are in Atlanta, Georgia. We are partners with the MTAP project. You'll learn a little bit more about our other partners. So today's webinar will be the Telehealth, COVID-19 and Intimate Partner Violence, Increasing Safety for People Surviving Abuse. We have our lovely presenter here today, Miss Rebecca. She'll introduce herself. We want to advance the slide. So these are some of the MTAP partners with us. So hopefully you all are familiar with all of them, if not some of them. Please reach out to them. Great organizations, great individuals who represent these organizations. So definitely, if any of them are on here, make sure you shout yourselves out. But it's been a great opportunity working with them. So different project timelines. So we'll give you some more updates about that a little later. But we wanted to make sure that this was a part of what we were presenting and providing to our communities. Next slide. So quick housekeeping rules. Or guidelines, not rules. So we do ask that you mute yourself when you get in, just so there's not background noise, and sometimes it's hard to know if you're already muted or not. So try to see if you see a little microphone to your left. And we'll try to tell people, in the chat or however we can if you're not muted. So now that I'm looking down the list, I can see some people who aren't muted. I'm gonna try to give them a second or two to mute themselves, or we'll send you a chat. We like the cameras off, but you're feel free to turn them on if you have something to say, or there's different reactions and things you might be able to use. So we do want this to be interactive, but we also do want to, focus on the content and things that are going on the screen. And Rebecca will give you more information on that. Please use the chat box. Again, this is recorded, so we'll be able to have this information, this content for everyone later. So that's why we do want a clean copy, or just be aware of the things that might be shared. I would say we likely have some editing abilities, so not everything has to be shared. And with that, I think that might be my last slide. Or do I want to do this too? Alice?
Great. Thank you so much, Wesley. Yes, I just want to echo, we are so excited to see everybody today. We also did want to share that some of you may be aware, it is currently Black Maternal Health Week, April 11th through 17th. So we know that there's a lot of events happening nationally, in states and locally. So some of you may be hosting some of those as well. So you can check out the website here to look at a toolkit and local events too. And I think that's all for me. So, I'll turn it back to Wesley, and then I think we'll turn it over to Rebecca to get started.
Yep, so thanks for joining. So again, more events that we have. Friday, April 16th at 1:30, same link. The recording we'll have for you all to share. Do want to, spread this information to everyone. We think that all of this information is useful. And if it comes from you, it means a little bit more. So do want to share that note, and we will supply the certificates to the participation for these events for part 1 and for 2.
Well, Wesley, I want to thank you, and Alice, I want to thank you. It's a pleasure to be with all of you today. My name is Rebecca Levinson, and I love the work that you do. And I've been doing work in a lot of different areas for a very long time. So I'll give you a little bit of a snapshot about who I am and how I kind of come to this today. So I live in California, and I ran 3 primary care clinics that did maternal health in the early 90s. And at that time, we we're doing case management of folks in our setting. And from there, I fell in love with sort of the intersection between community health centers and the issue of intimate partner violence and the way that it affects maternal health. So I went on to then work for Futures Without Violence, which is this little slide right here. So we are the U.S. Department of Health and Human Services National Resource Center on Health and Domestic Violence for the whole country. And in 2000, I had an opportunity we got a grant to do I did 32 site visits across the country with different home visitation sites, different models, different programs, and fell even more in love with case management than I had been when I was doing my work in clinic, because all of our work was happening in clinic. It wasn't going into people's homes. And so I've actually been trained tens of thousands of providers in my career. And I've been in every single state in the country except Delaware. So I have some things to say to President Biden, but he needs to get through a few things first before I have a chance to talk to him about coming to Delaware. The reason this slide is up is if you don't know Futures Without Violence, I really want you to know that I'm like going to touch on one little teeny thing today. And there are so many more tools and resources. The whole thing that we do is we take the best of the research, the best of the promising practices, we make model policies, and we kind of bring it all together, and then we listen, right, to all of you, because our partnerships are about healthcare providers, domestic violence advocates, and ways that we can best partner to support folks. Now I'm going to tell you that in my work, I'll go back one more time, I'll let you look at the slide. In my work at Futures, when I did those 32 site visits, if you had seen me all those years ago, you would have noticed that I trained you on how to deal with the issue of intimate partner violence with the clients, those folks over there, as opposed to what do you need? How can we support you? How is this impacting you? How do we avoid burnout? That wasn't where our heads were then. And so in the past 20 years, having listened to healthcare providers, social workers, nurses, home visitors, the like, what we heard is that you're no different, of course, than the folks that you serve. You're people with hearts, and those hearts carry not only your own stories, but they also carry the stories of the people that you serve. So we are absolutely in this together, and I am so excited to carve out some time for you. Because I know how much you've been giving to others, especially in the pandemic. So for all of us, I just want to take a moment to ask you to stop everything you're doing. So put down your phone for just a second. Maybe even take a moment and close your eyes. You know, and you can take your hands and you can rub them together like this. That's a really important grounding technique, right? So we've been sitting in this moment of national grief. We've been sitting in a moment of national grief about COVID and perhaps people we know and love that we've lost or are sick. We've been in a moment of collective grief about racism in this country, about the real things that happen to our families that we love relative to system involvement that hurt people, and really thinking about how all of these issues have come together. And the reason I'm mentioning this is not to stir stuff up, but to say today is a moment of hope. Because each one of you on the camera, I can't see all your faces, but each one of you in the work that you do with your families is about spreading that hope and spreading that joy. And investing in ourselves and investing in system change is part of how we move this forward. So I just really want to thank you for being here today and thank you for what you do. I know in COVID, sometimes taking care of ourselves can get a little lost. So also just take a second. So do you find yourself in a place of being really able to focus and be present, or are you having a difficult time being present in your life and with yourself? I'm just asking you to notice. You're not alone no matter where you fall in that continuum, but I'm asking you to notice because I'm hoping at the end of this, there's a little bit more capacity to be more present for yourself. So in the chat box, I would love to hear from my friends. There are about 43 of you on this call. I'd love to hear from you. How are you today? What sums up your feelings today? Just take a second and share with all of us. How are you today? How are you feeling? Busy. Hi, Christy. Thank you for that. Others, where are you? How are you feeling? Hopeful for a brighter future. Thank you for that. Blessed. Thank you, LaShonda. Blessed. Tired. I hear ya, Alicia. Scattered. Fatigued but content. Too many items to accomplish in one day. Bakersfield, California, hello. Connected, grateful, energized, tired but happy. So I see that there's sort of a range, and overwhelmed but challenged. Okay. I see there's a range of things. I'm not surprised. I guess the other thing that I wanted to do to just sort of build on this framework of today is about building on the resilience that exists among all of us on this call. I really love the framing that Maya Angelou gives us with this. Here on the pulse of this new day, and I know some places it's afternoon, some places it's a little earlier. In California, it's morning. So here on the pulse of this new day, you may have the grace to look up and out and into your sister's eyes, into your brother's face, your country, and say simply, very simply with hope, good morning. So one of the things that I've heard, because I've been doing a lot of work nationally since COVID began, I've been hearing a lot about what people feel like they've lost in COVID relative to the work that they do with the families they serve, with the pregnant moms they're working with the birthing folks that they're working with. And so I would love to hear from you all, because this is a slightly different slice than some of the other groups that I've been working with during COVID. What do you feel like COVID has taken away from you relative to your job? What have you lost? What do you miss? What do you miss? All right, we'll go into the chat. Face-to-face interactions, seeing people in person, the magic of being in a home, socializing with a person, group meals, connecting one-on-one with others, getting that energy from a group. Relationships, it's a bit more challenging to build rapport and gain trust on Zoom. Assisting others in person, a sense of normalcy and face-to-face interactions with my coworkers. My gosh, the water cooler, I miss it. Connecting with our patients, being able to hug your patient, amen. You know, so you are not alone. As I mentioned, I've been doing lots and lots of virtual training in Zoom, and here's some of the other things that colleagues of yours across the country have shared with us, especially if you were doing home visitation. You were driving from place to place, and frankly, for my friends who are clinicians or who are social workers who are also doing things in Zoom, you know, you miss out on that drive at the end of the day between where you work and where you live. And there was some grounding that happened in that time. You know, you miss maybe being able to blare the music several times a day as you're going from place to place, because we're not going as many places, right, because of COVID. Making that call to your person on the way home, because there's no extra time. So suddenly we're going from maybe Zoom call to Zoom call to Zoom call with patient, client. And then I don't know about the rest of you, but I have 4 children. Don't judge me. I have 4 children. And then it's Zoom call, Zoom call, Zoom call, and mommy, 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 mom, mommy, mom, mom, mommy, mom, mom, mom. And so that natural space for yourself has been absorbed in the context of Zoom. And that's part of what I'm hoping we can reclaim together. I think for some people, that sense of expertise that you have face-to-face and in person, for some people, they feel like, I thought I was really good at my job, but in Zoom, I don't feel very good about my job. I don't feel like I connect. I can't read it as well. I'm feeling really despondent or sad about the fact that I'm not connecting in the way that I used to. Also, I think a reality, not being able to focus on the families you serve in a way that's satisfying because your own family's at home. Mom, mommy, mom, mommy, mom, 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 yeah. Missing hugging is real. Missing being able to read the room is also very real. So I just want to say that you're not alone. And one of the things that as this list got developed and as I was listening to home visitors and case managers who are working with pregnant and parenting folks was this: what if you took some of it back? What if at 5:05, when you finish your last Zoom call, instead of going into the kitchen to start making dinner or snack or whatever it is you do at 5:05, what if you got in your car and you drove? You drove and got yourself a cup of coffee. You drove to the beautiful shoreline. You drove to wherever is a place or a space that just gives you a little bit of a moment in time. I did a statewide project in Maine, and this was one of the recommendations, and part of what we measured as a group was the folks that actually did this and how they felt versus the folks that kept going from that last Zoom call to making dinner or whatever the next things were. Sure enough, the people that actually took the time to drive where they wanted to go, to blare their music or to have silence, whatever feeds your soul, those are the folks that said, that was the best thing ever. I can't believe I didn't come up with that on my own, but like I walked back in and suddenly I was myself when I walked back through the door. I wasn't carrying all the stories that I heard all day long. So I just really want to encourage all of you to think about this strategy. The other thing I want you to think about, my system friends, anybody who's a manager or supervisor on this phone, and you can do this in the chat too if you want to, but how many minutes a day when you were all face-to-face working together, do you think you chit-chatted? Go ahead and share. Was it maybe 10 minutes, 20 minutes, 30 minutes throughout the day? How long do you think you had face-to-face time? Just a couple minutes here, maybe a coffee break there. How much time did you have with your colleagues when you were face-to-face on an average day? I'm gonna look at the chat here to see what folks said. How much time do you think you had? More than an hour, 30 minutes spread out. Anybody else? How much time do you think you have? So those two right there, I want to say, let's take those back. 30 minutes to an hour. Because the thing is, we haven't replaced that in COVID. Most folks I know have not really replaced what they had before. So part of what today is about, because the next time I see you, we're going to be talking about something hard. We're going to be talking about intimate partner violence. So today is all dedicated to you and how we build muscles for you to have more capacity to hold trauma, but also because you deserve it. How do we help you have more capacity and build those muscles? My supervisor friends on the phone, you know, we haven't structurally, because we've all been reacting to COVID. So this is not a criticism. It's a thinking out loud with you. But since COVID hit, you know, our feet hit the ground. We kept serving people. We didn't eat lunch. We Zoomed all day. We had lessons learned in Zoom that were painful. So we didn't actually think about, well, how do we create Zoom or this change in workplace to feed our souls? We didn't have time to do that. So that's what I'm hoping to do today, is to think about that. So can we carve out 10 minutes a day, 15 minutes a day, 30 minutes a day, and say, okay, from 11:30 to noon, that's me time. I'm going to call Alice. I'm going to call Wesley. I'm going to check in with them. And maybe we're going to talk about how, thank God, we can close doors sometimes and then children are on the other side of them as opposed to in them with you. Whatever we're going to talk about, but the same things that we would have done. And some of you are doing it organically, but I'm literally talking about carving out time in your day as a way to reduce burnout. Anybody else want to share? Well, I wanted to share, because again, I've been doing a lot of this, how people inspired me and what they've done. there was a case manager in Maine who loved to go to yard sales, like, you know, flea markets and yard sales, and would pick up all these old postcards for, you know, 10 cents or 25 cents or whatever, and had a big old stack of them. And what she decided to do was write a little note to every single one of her moms on one of these postcards. And she said, Rebecca, like, people would hold up the postcards. They showed me where they specially taped it on their cabinet, where they put it on their mirror. They loved it so much. So that was a way of creating connection, that the next time they chatted, they had something to talk about. One of the other things that I think it was LaShonda, you told me about, you know, your young person who wanted to share music. Some of my folks who are working with toddlers and the littles, or the chunkalunkas, as I like to say, they actually also did a mailing thing, but they did it so that the kid would absolutely know that this was a magical card for them. So they had special envelopes and glitter tape to put on the outside, and emojis and all these other things. And so then that they would work it out with the mom so that they'd open it together on Zoom so that they could have that connection. So that was another thing that they did. The other sort of benefit or innovation in Zoom is, for, you know, when we're in a clinic or we're doing home viz, shadowing can be difficult. You got to get two people's schedules together, et cetera. But on Zoom, as long as I'm free at 3 and you're doing your work with a client at 3, it's really easy for me to jump in and learn from you and experience your expertise. So we saw more sort of the shadowing experience and this mentoring really flourish. And I hope that's something that will stay after COVID, because it made a lot of sense that you didn't have to worry about logistics of getting from point A to point B if you were doing a home visit, or even, you know, sometimes your visits run over, et cetera, when you're in clinic. And so it was a great way to sort of build on something that had been a little bit harder in the past. Lamination is something that folks also did. So one of my home visitors was really worried about an infant. She'd never met the mom in person or the infant in person. The mom joined late into her pregnancy to the home visitation program. So the home visitor was worried about it. So they laminated all of these baby faces, right, onto one great big poster board. And then they asked the mom to hold the baby up to the screen, and then let's see what happens when we show the baby all the faces. Well, sure enough, the baby loved the faces, right? So there were so many cool things that happened. And you all talked about missing hugs, and you're not alone. When I was doing work in Alaska, one of the things that an innovative home visitor did is she sent a lovey, like a bear or a bird or whatever the stuffed toy was. And then she had the same one herself. So she would start her visits Alice, can you see on my screen?
We still see the slide deck.
You see the slide deck. You don't see something saying?
Nope, just a slide deck.
Okay, I'm seeing. Okay, great. I'm not going to look at it then.
Yeah, we could see it pop up, but then it went away. It's just a slide.
Great. I was just worried you were still seeing the pop up. Thank you. So what that home visitor would do is they'd start their, hi, it's so good to see you, and let's give each other a hug. And they would each, the toddler and the home visitor would give themselves a hug, and then they'd switch arms. Well, we know when we cross the midline, when we do this, and everybody can do this on this call right now. Alice, well, you know, you can all try it. Squeeze yourself really tight and hard. That does great things for your endorphin levels. And it does great things to build connection with another person. So don't underestimate the power of that. So that ended up being like, the kid would run with that toy when it was time for the visit, and, you know, so excited about that. So we talked a little bit about rethinking hallway chat earlier, so let's skip that. One of the things, part of what you all need to know, and we'll talk more about this next time, is with COVID, with crisis, with more poverty, with less access, with more isolation comes more intimate partner violence. And I say this because that weight is falling on all of us on this call, because we are caring for our own families, our own friends, our own siblings, our own parents who may have some of these issues too. On top of that, we have a full caseload or a full patient load that we're taking care of. So I just want to acknowledge all of you, because we know that first responders for families experiencing domestic violence or child maltreatment are you. You might be the only other person in contact with families and parents you support. You might be the only one they're allowed to talk to. So that's one of the things that we're hearing from folks in the field, is that the power and control that's showing up with intimate partner violence is about who gets to control this device. Who are you allowed to talk to? Who you're not allowed to talk to? You might be the only kind word heard. You remember how I told you about when the postcards got sent out, that all the clients went crazy about it? I want you to think about if that was the only thing that you got in the mail that wasn't a bill or something like that, where someone said something sweet and kind about you, just the power of that action. And so we're going to talk a little bit about how we can use the power of good compliments, kindness, things you do organically, but as an intention, to build this connection in COVID and help reduce isolation for the families you serve. And you also might be the only access to information on health and safety. So y'all have heard about trauma-informed care. This is not new. It's been around for a while. These are the elements of it. I wanted to mention it to you because I think we're tired of trauma soup. And I think that what we're seeing in the field is that there's a real hunger for wholeness, for whole system care, for whole human care, to look at ways in which we can build equity, ways in which that we can reduce implicit bias, ways that we can expand the love in the room for the folks that we serve and for ourselves. One of the things that we know about trauma-informed care is that from the federal government's perspective, that's not just something limited to the clients you serve. It is also something for systems, the system you're a part of, to work on as well. So SAMHSA recognizes how trauma affects individuals involved in programs, organizations, systems, including its own workforce. So I'm going to talk about how we are going to hold both workplace response and responsibility, and also what does self-care actually mean? Because I think that we have to have differing opinions about what that means, and I wanted to get us on the same page for that. But more importantly, this is where I think this is the next step of the work, right? So how do we build on the principles of trauma-informed care and take it to the next level and move out of trauma into healing-centered engagement, right? So we know trauma-informed care is important, but it's not complete. It doesn't acknowledge that trauma is experienced collectively, not just individually. So when we think about, for example, George Floyd, when we think about choices about doing anti-racist work, when we think about ways in which systemic implicit bias and systemic racism work, we're thinking about how a whole contributes to a story, and not just an individual story, but it's all part and parcel of this bigger, broader frame. We know that trauma-informed care fails to address the root causes of trauma that exist in the environment, not just in the individual. And it focuses on coping with symptoms rather than healing from them. So this is a shift that's being made in the field. And part of the reason why I'm sharing this with you is because we know about the research relative to people who care for other people. So we know healthcare workers are more likely than the population at large. So if you're a plumber or you're an electrician, we are much more, all of us on this call, likely to have experienced personal trauma. It's estimated that 68% of healthcare workforce has experienced at least one episode of violence, abuse, or neglect. When compared to their colleagues in other industries, they're also more likely to experience workplace violence because we're working with the public very closely and lots of different folks from the public very closely. And I think the other thing that I've mentioned is no surprise. Again, when we listen to people's stories, we also, all of us collectively as healthcare providers or folks that are caring for others, experience secondary trauma and vicarious trauma as a result of listening to those stories and carrying those stories with our clients. So I'm going to give you the definition of a healing-centered engagement, which is a healing-centered approach is holistic. It involves culture, spirituality, civic action, and collective healing, right? Because that's how we change the game. A healing-centered approach views trauma not simply as an individual isolated experience, but it highlights the ways in which trauma and healing are experienced collectively. So this supports providers with their own healing, asks the systems to build in structures to address the realities facing healthcare staff, helps staff better support patients and be present with themselves and their colleagues. And because healing is a process we all need. So there's nobody who doesn't deserve healing-centered engagement, if that makes sense. Now, I'm showing you this slide because I had an experience in North Dakota that kind of changed my career. And I was doing kind of a touchy-feely talk on self-care, and I got to a slide that laid that out. And in this room, wall-to-wall people, there's probably 100 people in the room, I see this group of 5 who are all sitting next to each other in the back row, and they all did the arm and the slump and the eye roll and the head toss all at the same time, and I almost was blinded. And I held together, but I went up to them at the break and I was like, hey, I didn't say I noticed the eye roll and the slump, but I said, hey, I noticed the energy in this corner of the room and I just wanted to acknowledge it. And I'm just checking in with you if there's something I said that was wrong, or, you know, I'm just wanting to understand what happened because it was so visceral. I watched it, it happened like in a snap. And they said, oh gosh, Rebecca, sorry, this isn't about you. But, last week, our supervisor all made us go to a self-care workshop because we were supposed to fix ourselves. And I mean, I literally covered my mouth and I said, wait a minute. So self-care as part of power and control and shaming and all these other things, I hadn't really thought that it could be used as a weapon as opposed to something that could be supportive. So this slide is really to remind us that I am not laying this on your shoulders. This is not just yours. This is our systems to take care of us, just like our systems are responsible for taking care of the folks that we serve in inclusive, meaningful, equitable ways, right? So self-care does not replace the need for organizational changes that better support you all. Nor does it take away the need for us to have our own personal self-care practices. Self-care and organizational support need to both exist for a more balanced work environment. So that's why I gave you a tandem bike, because if you've ever ridden a tandem bike, you can't ride it by yourself. You really do have to have another person to keep it going. If you're interested in more about this, and Alice, you can drop this in the chat if you have a second, but Trauma Informed Oregon has been doing some really interesting stuff. So they have lots of tools there to expand on this. And then I'm going to show you another tool in just a minute that also, you don't have to recreate the wheel. It's out, there's lots of good stuff there, so don't worry about that. This tool is actually taken from something you can download, a PDF. It's called What About You? A Workbook for Those Who Work with Others. And it was developed by this National Center on Family Homelessness. Now I know the folks on this call may or may not, maybe you have an occasional client that's homeless, but that's not the focus of your work necessarily. But the reason I'm showing you this tool is it was developed because the burnout rate was so high for those staff. And that issue of turnover, and every time a nurse leaves, a social worker leaves, a home visitor leaves, a doctor leaves, all those years of experience, all of those lived experiences that you had, all of your insight and wealth of knowledge about how to bring up the youngers who are kind of coming to do the work with you, it's lost, right? So this toolkit has a lot of pieces, including this organizational self-care checklist. And it's doing what we say, well, I think what most of us try to say that our organization does, but it looks at employee control and input. Do you have any? Are you, does your voice matter at the table? It's sort of the same idea with the clients you serve. Are their voices fully being heard as part of your system? What is your work environment like? Light bulbs matter. Is there, we're coming back from COVID, there's extra money out there. let's replace all of those horrible blue fluorescent light bulbs with something that's warm, because we can show you the science about why that matters for mood, why that matters for comfort for you and for your clients. What's your training and supervision? So it's asking all of those things. And so you as a team can do this. Give this information to your supervisor so that they have a clear picture of what your experiences are. And then my friends who became supervisors, and it was like, you didn't go to supervisor school, because neither did I. I went from being frontline in a clinic to running the clinic. There was no special program. I was still me. And suddenly I was supervising 75 people. You're not alone in that. Oh my gosh, I don't know anything that I don't know. Of course, none of us do. But that's why this toolkit is so helpful, because it's built around how can you as a supervisor, here are the things. Here are the things that make a difference. Here's how you build this really great workforce support and capacity. I don't know how many of you currently have a protocol for your own staff who might be experiencing intimate partner violence. Chances are, unless you're part of a great big system that has some tool somewhere, you maybe don't. And again, this is not to shame anybody, make anybody feel bad. It's to say, there's a really simple tool to support my supervisors out there. And it comes from Future's Workplaces Respond Toolkit. And if you go to that website, workplacesrespond.org, it gives you a tool that you can populate. So if the name of your organization is Maternity Care North Carolina, you type that in only once, it populates the whole document, but it gives you step-by-step things to do if it's one of your staff. It talks about what to do about a restraining order. How do we have a safer workplace? What does supportive supervision look like? So you don't have to, again, reinvent the wheel. It's right there for you. We also were really thinking about COVID and the stress that your staff are under, the stress that you're under, frankly, as a supervisor or manager. And so there's a toolkit that's specific to recognizing what's happening in COVID. I guess lastly, this is, how many of you have heard about that? Is it a metaphor or an analogy? You know how when they talk about, okay, you get on an airplane, you put on your own airway mask first, and then you put it on your child or the person that's not able to do it themselves. I don't think this work is really about that. It's not that simple. And I love this metaphor more than any I've ever heard. A metaphor for practicing resilience. And I'm just going to go ahead and read it to you because I think it'll resonate. So scuba divers, so forget the oxygen mask in the plane. Scuba divers use oxygen tanks to help them survive in the sea. They must carefully check their equipment before expeditions, consistently monitor the remaining oxygen left in the tank so they can take actions to get themselves to safety before they run out of air. And crucially, scuba divers use a buddy system, right? Accountability partners is what it's called. They do not do this alone. Now, Mike, I'm going to stop here. Is that how your system is set up? Do you have a buddy who's checking your tank, who's checking in with you? Remember how I told you, let's steal those minutes back? Let's steal those minutes back. And let's also build in what we know is something that's going to help the staff not run out of oxygen. Because when you run out of oxygen over and over again, you get too tired to keep diving, right? So while exposing ourselves to secondary and vicarious trauma, we need to stay mindful to the extent at which our oxygen is being sapped. And if you scheduled in like 11:15 to 11:30, you're going to do a check-in and you're going to talk with Yolanda or Alice or Wesley about how is their day going? How are they feeling? What was their time like with their clients? I mean, this is all sort of the science about how we can be doing Zoom better and connecting with colleagues better in COVID. There's another tool, and some of you have seen it, some of you haven't, but there's something called a professional quality of life scale. We call it a ProQoL. It's free, it's on the net, you can pull it off. But what I like about it is it helps you measure your own compassion fatigue and get a sense of where you are with that. So for my supervisor friends or managers, system people, this is something that you could download and then have for your next staff meeting, and have folks use that there. I think that that could be a really nice way to kind of continue this conversation and not just have this healing-centered engagement be a one-stop thing, but an ongoing thing as part of everybody's practice. Okay, so we just covered a lot of territory. I want to hear in the chat, was there anything that stood out to you in the slides that we covered? Was it the taking yourself for a drive? Was it checking your oxygen tank with a buddy? Was it about stealing back time with your colleagues and, you know, and getting paid for it, darn it, scheduling yourself in the same way you schedule your clients? Because what are you doing when you schedule your clients? You're taking care of them. So this is about scheduling to take care of you and your colleagues. So I'll just be curious to hear, does anything stand out for folks in the chat? Scuba diving metaphor. I like the buddy system theory. Thank you, Christy. Nice. Okay. All right. So in the spirit, oh, well, there's one more comment. Let's see what that says. So I want to bring it back to this idea of self-care. And, you know, I think sometimes we think about self-care as a mani, a pedi, shopping, you know, taking yourself out to lunch, something like that, snack, delicious treat on your way home. There's a place called Happy Donuts here in Berkeley that's like kind of it was a happy donut kind of need day. So people do that. But in fact, and I think this is something so essential for this moment in time, especially. At its core, self-care is about rituals meant to calm the nervous system. So in A Burst of Light, Audre Lorde writes, caring for myself is not an act of self-indulgence. It is an act of preservation. And that is an act of political warfare. It is hard to take care of ourselves when we are constantly being pulled in 60 different directions to take care of the needs of others. And I think so in Zoom, especially in this place where all of the natural breaks have been removed, stripped from our lives, our cars, the water cooler, other kinds of things, we have to be so incredibly intentional to bring that back. I mentioned before that my hope is that from today, you will go back to your colleagues and plant some seeds and say, hey, I want you guys to watch the webinar we saw, but also there are other supports out there and you can make this part of your staff meeting. So this is a series of 3 different webinars: loss, self-care and healing, surviving in the midst of a pandemic. What I like about these and what I think will resonate for all of you is they're kind of done in like 15-minute segments. So you don't have to watch like a 2-hour thing or even a 1-hour thing. You could just watch 15 minutes and talk about the cool stuff that came up. The link is there. Another tool for my supervisor friends. So supervising during the pandemic is an info sheet that you can get off of Futures. I think our Instagram account. So it's helping support with empathy and compassion, managing expectations and workflow, helping your managers manage their expectations of workflow, I think is part of it, right? Because we're educating them along with ourselves in this process. How to be consistent and transparent, share resources and prioritize self-care. It's really, again, pushing systems toward where we should have always been. One thing I want to take note of, which I found to be really interesting, is that a lot of times when we hear about how staff are unhappy in their workplace, the answer to making them happier is simpler than you might think. Control over work has been identified as a protective factor in worker stress. So for my friends who in Zoom land, maybe you're having some comfort because all of a sudden it doesn't matter if you schedule from 9 to 6 or 11 to 7, because that works better with your kids' class Zoom schedule. And you can help your child from that 7:30 or 8 to 11 o'clock window. And then you take care of patients from there. But being able to help reduces your stress because you're not anxious about that your child needs some more help there. One of the things I want us to think about collectively as we come back, and I think that nothing will ever go back to the way it was. I think that there will always be more of a hybrid model for care, you know, in home visitation and in telehealth medicine or OBGYN care. It's much easier in some cases for clients to do the face-to-face on Zoom, so they don't have to drive and park and, you know, all the other pieces. It's easier for them. I've heard especially about adolescents that they've had much more success with adolescents in Zoom because it's no big deal if you can't do the 3. It's like, you know what, I got a slot at 5. Does that work? So the flexibility and the fluid part of it is real. So I am hoping that as part of system change, workers' perception of control and being able to exercise professional autonomy in their work will be something that is nurtured and supported and seen as a core value for systems of care, because that's going to help reduce our burnout. So the last bullet I'll read to you, the perception of control is also associated with higher job satisfaction, life satisfaction, better performance, lower stress, and empowerment has been shown to decrease burnout. So there's the science behind why we should really take up the mantle of changing our systems permanently from things learned from COVID. Okay, so this is a chat box question for you. Name one simple way we achieve greater good in the workplace for both ourselves and our work. That's one simple way we can achieve greater good in the workplace. Well, one was the autonomy I just talked about, but can you think of another example? To model, okay? Model self-care, okay? Fun environment, create space for growth and innovation, love it. Flexibility, ability to adapt, keep negative out, nice. Self-care, nice. Normalize self-care breaks, beautiful. And you know what? Okay, we're just gonna do it because I'm gonna show you a little science behind exactly supports what you say. I know this is, it should not be radical, but surprise, employees who took a break every 90 minutes for 5 minutes, just like we just did together, reported a 30% higher level of focus than people who took no breaks. So that overworking thing, like I'm just going to work twice as hard as everyone, biologically, physiologically does not work. But I think the second bullet point is my favorite because I think it's the definition of everything that you do. So those that took breaks had a 50% greater capacity to think creatively. Isn't that the definition of what you do? Every client is different. Every patient is different. Every mom, every birthing parent is different. Their needs are different. Their stories are different. And you're trying to, in real time, figure out how you connect, how you meet needs. So it's just a great example. So I'm going to challenge all of us. What if we set, you can get an app, there's apps for this too, but a timer every 90 minutes as a little ping to remind you. And I'm not saying, because Alice won't have me back if I say this out loud to all of you, excuse me, my phone just rang. It's a little bit of me time is needed right now. No, I'm not saying that. But I am saying that after you finish that Zoom call, it's okay to go text and say, I'm running 5 minutes late, and take that 5 minutes for yourself, right? That it's those kinds of conscious choices. And you could do this as a team. You could say, Alice, Yolanda, Wesley, Rebecca, we're all going to take this on and we're going to see how consistent we were. We're going to all keep a little, spreadsheet of did we do it? Just simple check marks, right? I did it 3 times today. What did you notice when you took that break? Well, I noticed I wasn't breathing as fast when I took that break. I noticed I just felt better when I took that break. So I'm just going to encourage all of you to think about how you can do this as some kind of group challenge or a personal challenge moving forward. I also thought this research was really interesting, you know, and I'm an extrovert. I know it's hard to know that, but I actually have really struggled in COVID because I need people. That's how I recharge. I don't recharge by myself. But what I appreciated about this, even as an extrovert, is the key to reaping positive rewards comes from choosing to spend time alone. And I mean choosing as opposed to being imposed on you because of COVID. But do we take the time to carve out time for ourselves, right? So despite the social stigma and apprehension for some people like me about spending time alone, it's something our bodies crave. Time alone is what we need to feel better. What happens when we have the freedom to do anything? No pressure to talk to anyone, no obligations to make plans with people. It frees us up. Time with your thoughts without social distractions can build your confidence and make it easier for you to maintain boundaries, boost productivity, and engage with each other creatively. Okay. I love this picture. It is a real picture. This is a picture of my dear friend, Lisa James's daughter. She's the director of health at Futures. Her daughter is the little one on the side. Her name is Elta. Elta is now 14 or 15 years old, so it's okay we're showing this because she doesn't look anything like this anymore. But Elta's on one side and her friend Ellie's on the other. And the backstory is this. Elta had been weaned off, we call them in California, binkies, all of her pacifiers. And they had gotten washed, and Lisa was going to give them to a friend whose child had outgrown their smaller binkies. You know how they go from, they had the little baby ones, and then they had the bigger ones. So she had washed them to put in the cabinet. You know, Elta had a big birthday. I think she was maybe 3 in the shots. I think a three-year-old birthday meant no more binkies. We got a lovey to replace the binkies. So she and her friend Ellie had gone upstairs to play, and they were playing, and she could hear them laughing. And then all of a sudden she was in the kitchen and they got really quiet. And she was like, oh my God. So she ran upstairs because she was sure that the Sharpie had come out and they were drawing on the walls or each other or something like that. And she busts open the door and this is what she sees. So I've never seen a better image of self-care in my entire life than this picture, because there's no more room for self-care. It's completely full on both of their mouths. So I guess as you're looking at this, I'm wondering, on a scale of 1 to 5, 5 being self-care, intentional, a force that you are not going to let go of inside of yourself, driving force to take care of self, to 1, really hard to get there, really hard to put myself as anything on my own priority list at all. What's your number? How many of you are 1s, 2s, 3s, 4s, and 5s? I'd love to hear in the chat. Where are you on the scale? Jane, I love that you're a 5. Thank you for April for sharing your 2. Wesley, 4 but a 5 in my mind. Oh my God, that might be my favorite one. 3s. So what I'm really hoping for all of us is, Wesley, that your 5 can become a reality. It doesn't have to just be in your mind. It can actually be like real things on the ground, that we're all able to move a little bit more as a result of today's training, because you're going to have a lot more tools in your toolbox to be thinking about how to prioritize this in your life. And your system should be helping you do that. It's not just you. So a couple things. There's 2 books. One of the things that people have done, because they're not spending money necessarily on travel in COVID, people aren't going to conferences, maybe they have a little leftover money in their budget. So one of the things that we've seen folks do is send out care packages to staff. So like my friends in Maine, one of my supervisors in Maine sent out a care package that had socks in it because they're good for the soul. Kit Kats because they remind you to take a break. Anyway, they have a whole bunch of really creative ideas. And then they also sent out this trauma stewardship book. And if you don't know Laura Vandernoot-Lipsky's work, what you'll love about it is it's really funny. And she talks about not realizing how crispy, crunchy fried she was in her own work until she was walking and there was like kind of a cliff in front of her and she was looking at the cliff and thinking, well, that seems lovely. Like jumping off the cliff might end some of her pain and suffering in her work. So she talks about if we're to do our work with suffering people and environments in a sustainable way, we have to understand how the work affects us. She also has a new book out called The Age of Overwhelm. So one thing people are doing are sending this as an audiobook or an ebook or even a physical book as part of sort of taking care of the staff. So I wanted to plant that seed too. I don't know if you've ever heard Brene Brown speak, but I love her so much. And she's a researcher out of Houston, Texas. She talks a lot about vulnerability and shame. And but what I like about this TED Talk, and you can maybe put that in, Alice, for me, if it's there, you can read it on the slide. Maybe you can't. But what she talks about is what we're starving for neurobiologically, and that's connection. But even though we're starving for it, even though humans are looking for connection, stuff gets in our way. Shame, fear, vulnerability. So I'm not gonna be vulnerable or put myself out there because that's too overwhelming or difficult for me to think about. In order for us to build connection with others, we need to be seen, and I mean really seen, for who we are. Maybe a little bit in our mess, a little bit in our truth, you know, not a facade that we put up, but in fact, just seen for who we are as humans in the world. And of course, that's exactly what your clients are looking for too. So to do this, we need courage, meaning we need to connect with our whole hearts. All right. So this brings me to the CAPE. For all of you experts in your field who are taking care of families, taking care of pregnant women, birthing folks, I want you to think about your CAPE, because I'm pretty sure all of you have at least one, if not, in my case, 27 of them. Some of them go with my shoes, some of them don't. But for sure, I have one in my glove compartment, in my purse, in my kitchen cabinet. And I want you to think about, when do you put on your CAPE relative to the clients that you're serving? When do you throw that thing on, and what's happening when you do it? So can anybody give me an example of when does your CAPE come out relative to a client or patient you're serving? When does your CAPE come out? Okay, maybe I got to give you a little bit more on the CAPE, maybe.
And I think they're likely typing, so they might be.
You think they're typing? Okay.
Yep, there we go. We got some coming in.
All right, I love it. Whenever they're in a crisis, when they mention an issue or a problem, yes, okay? So I will quickly tell you this. When I was a little girl and a young woman, my sister and I lived with my parents on a dirt road in the middle of nowhere in Colorado. There was no gas station in my town. There was no grocery store in my town. We weren't homeless, but I definitely qualified for free lunch when I was a kid. And in my home, there was also domestic violence. So, and childhood sexual abuse. So as I grew up, my sister moved to New York. I moved to San Francisco. And my sister is now in this abusive relationship in New York. And let me tell you what I did. Forget the client thing. This is my sister, my baby sister that I protected during our childhood. And I was like, I know what we're gonna do. I'm gonna show up in a cab. We're gonna just throw everything out the window. We're gonna put stuff in suitcases, wrap it in a bedspread. I'm gonna come get you. We're gonna go. Okay, so hold that thought. And you know, you did the same thing. When people are in crisis, we're gonna help them. What do we take away from others when we use our CAPE? Who was the CAPE about in my case? Was it about my sister? Or was it about me? The answer is it was about me. Because if I had actually listened to my sister, who was saying, this is really hard, I really love her, all of that. It's only bad when she drinks, all that. She didn't want me to put on a CAPE. She wanted me to listen to her. So I kind of blew it. Going back to Brene Brown, I felt vulnerable. I felt scared for her. I felt worried for her. And I bet you feel that way about your clients too. I'm worried for you, so I'm going to take over. Because that way I'm going to make my heart slow down. I'm going to be a little bit more calm. I'm going to feel in control of the situation that, of course, no one is in control of. So I think this thing about what do we take away from others when we use our cape? We take their voices. We take their strength. We take all of the ways they've been surviving all of this time. Someone else has something to say up here. So good, let me see. Trust that others can navigate and have critical thinking skills to navigate through their trauma and crisis, as scary as it may seem. April, you couldn't have said it better. So in this process of creating connection, we have to watch ourselves not create disconnection as we're taking care of ourselves with our capes. I'm not saying I got rid of all my capes. I know where they are. I'm just saying I work personally, and I'm not kidding when I say this. It's not always easy for me not to stick on a cape, and sometimes I still slip. But I'm trying to catch myself faster. And in doing that, I open all kinds of doors for connection that I really want, and the person that I love or the person that I'm working with really wants to. Some of you get reflective supervision. Some of you don't, I'm going to guess. But let me just ask out to everyone. Is there anybody on this call that does not get regular reflective supervision? So that means your supervisor sits down with you once a week, every 2 weeks, at least once a month, to really unpack any issues that are going on in a safe, non-judgmental way that supports you, supports your growth. Are folks receiving reflective practice? You can say yes or no, that would be helpful. Not anymore. I used to for 5 years and I really miss this. So April, here's the thing. It's so a cost case to make this. Yes, you're getting it. Good, Angela. Because I do hear about programs that get rid of reflective practice. And it's so bad for that program, that system, and because you need to be fed, right? And the other thing I'm going to say is I've been on this campaign to say for supervisors and managers, you need reflective practice too for yourself. Forget just, you're carrying not only the stories that your staff are carrying, but you're also carrying all your staff. Reflecting on previous jobs, when I did more direct service, I stopped getting it when I became a supervisor. And Alice, this is what I'm saying. Did you want it when you were a supervisor? I mean, holy cow, you were carrying what, 20, 30 staff and listening to all their, do you want to unmute yourself and tell me a little bit about it? Go.
Sure. I felt like I wanted it more when I was a supervisor. I needed it more, and it just wasn't there all of a sudden because it was sort of the message of you get promoted to this role. You must not need that anymore.
Exactly.
Which isn't true.
Is something we're hoping to see systemically addressed and changed. So I switched agencies and positions, so reflective supervision is not part of my current agency. And frankly, I don't care whether you're a home visitor, you work in a clinical setting, a hospital setting, you're a standalone OBGYN, everybody benefits from this. You will have a happier work environment. You will be happier if you engage in this practice. And if you're interested in learning more or getting more training on reflective practice, so April, if your supervisors or the managers you're working for now want to learn more about it, this 0 to 3 website is really helpful to building that. But I also just want to say, oh shoot, I must pull that slide out. I put it in. Alice, do you remember the slide I was trying to put in before? Maybe it didn't make it in. Okay. Just that for my healthcare provider friends, so my, and more, so any doctors on the phone, any nurse midwives on the phone, any others on the phone that are working in a more traditional clinical setting, there is this great reflective practice that's a kind of a group facilitated practice that is showing to make an enormous difference. So it's not necessarily has to be one-on-one, but just you stop at 4:30 on Fridays and you open up this group to sort of unpack the difficult cases that week, look at what how are you doing in that process and get additional supports there. So I just want to say that this is not limited to home visitors or social workers or those kind of jobs over there. Those no, it's really for everyone, and there's research behind it. So we can help you connect to those resources if you're interested after the webinar. Okay, so I want to give another great example of what we do in the name of love in our practice. So Alice, you promised you'd be my partner on this. So I'm going to set the stage here for all of you. Alice and I have been working together for 20 years. We know everything about each other's lives. We know about partners, kids, family that's kind of off the rails. We know all of each other's stories, and we've been working together forever. So we're kind of like this. It's like butter, as they say, right? It's just this. We connect a lot, and I am going to set the stage for how we're going to connect in the program. So the story is it's 5:15 on a Friday night, and I call Alice, and Alice picks up the phone, and this is what I say to Alice. Oh my God, Alice, I just got off that call with that family I told you about. You remember the ones I was telling you about, the Wesleys? Oh my God. And so that mom, you would not believe the hell that she's been going through. And I feel like I missed it. I feel like I can't believe that I couldn't see it. And when she shared her story with me, and then I understood how the kids were involved too, I am just like, I want to throw myself under a bus right now. I just can't bear it. Fine. So Alice, how did that make you feel?
Physically, I could feel my heart rate going up, and I just wanted to take away some of that distress from you. I was feeling overwhelmed for you and wanted to felt pressure to take that away and to say something to make you feel better.
You're so cute. So did everybody notice what she just said? She was focused on me, but the question was about Alice. How did that make you feel? How did that make you feel, Alice? You said a little bit like your heart was racing, but more. Tell me more. It's 5:15 on a Friday night.
It's 5:15 on a Friday night, and I am just trying to get home to make dinner, to feed my kids, and I honestly wish that you hadn't called to word vomit on me.
So fair. Okay, so here's the thing, right? I've been doing this work for a very long time, and this is how you showed love in a clinical setting. This is how you show love in home visitation. This is how we show love in areas of healthcare that are about one-on-one services. And what I just did was terribly toxic for me because my heart rate was through the roof. My cortisol level just spiked, and so did Alice's. So this was bad for now our home visitation system, right? Because 2 of the home visitors are now completely dysregulated and upset. So that's called high impact debriefing. And what we want to teach is something called low impact debriefing, right? So the first part of low impact debriefing is me noticing me, right? I didn't even give myself a second to say, oh, Rebecca, you're like ready to pop. You need to just take a minute and take another minute, maybe even a third or a fourth minute, like ground yourself, wash your hands, whatever you need to do to kind of come back into your body a little bit. But I wasn't even I was all in feeling. There was nothing that was grounded in the world inside of me. For all I know, Alice, you said you were going home to make dinner, but what if you just got a call saying your mom tested positive for COVID? What if you just got a call from the school saying, yeah, Johnny didn't show up again all day long for class, even though he told you he did. He wasn't on any of his Zoom calls. I didn't give you fair warning. I didn't say, hey, Alice, I'm kind of having a moment. Is this a good time? I didn't ask for consent. And I sure as heck didn't do limited disclosure. I just vomited, to your point. So all of a sudden, whatever you've been carrying with you all week long just got twice as heavy because of my dumping on you. And we are doing this constantly to each other in the name of love, and it's hurting us. So I'm hoping that this is a container that helps you all, again, keep talking about this. Keep talking about this as a group. Are you personally a decision? I want to try to change this or look at this in myself. I want our system to look at this. Are we able to do more of this low impact debriefing? These are all really good questions to keep talking about as you move forward. Okay, so this is a little pen and pencil exercise. So hopefully you have, I'll give you a second to, I didn't forewarn you about this one, but you can use Post-its, you can use piece of paper. So the goal is to make a list of 5 things in your past that you're not proud of. And I'm not looking for anybody to get triggered. I'm not looking for disclosures of anything. This is your list. And I want to make it a little on the smaller side as opposed to the bigger side. Like probably, for example, I wouldn't put on my list of things that I'm not proud of. Or maybe I would actually, I'm past it now. So I could say the thing about my sister. But I'm not, I really don't want to trigger the group here. So like examples of this might be, I lost my temper. I judged a friend. I wasn't patient. I forgot my friend's birthday. And I'm going to show you this next slide. So if we were in person, I would give you this worksheet. But since we're not, I'm just going to give you the visual. So you're making three little columns. One is the past mistake, the evaluation of yourself. So when I made that mistake about my sister, I shared with you, I said, oh my God, I'm such a shitty sister. I'm such a bad sister, right? I have no compassion. What is wrong with me? I was like, it was dark, okay? But this third column is really interesting, right? It's the evaluation of your behavior. So write down the mean talk you said about yourself. How did you evaluate yourself in the mistake? And the third column is evaluating the behavior. So forgetting the birthday was not so thoughtful, right? So I want you to think of maybe 3 to 5 places that you made a mistake or had a regrettable action. I told you I have 4 kids. I certainly could always yell at my children under my mistake or regrettable action. And just take a second and try to do all 3 columns across. Let me give you just a little bit of time to work on that. We want to be thinking about is how do we take care of ourselves in the way that we self-talk, right? So I could continue saying, I'm a terrible sister. I'm the worst person who ever lived. Like, how could I possibly, at this point in my career, I was doing work around the issue of domestic violence. I was sort of someone who was supposed to know something about something. And I was like, somebody needs to take away my microphone and I need to stop doing this. Like I'm a fraud, I could go all down and deep. But when I could just isolate the behavior, which again, gave me some awareness about myself, it changed the game. So that's what I'm hoping this helps you all do. Anybody else want to share one before we move on? All right, so some of you know about the FAN, which stands for Facilitating Attuned Interactions. Linda Gilkerson is out of the Erickson Institute in Chicago. She is a PhD social worker who trains master's level infant mental health workers, so the folks that are going to be working in perinatal case management, who are going to be working in with early childhood settings, with home visitors, with case managers, et cetera. And I fell in love with her model and her many years ago because Linda talked about these 20-somethings in most cases, some in their early 30s, but most in their early 20s, who were coming to become these mental health infant experts in her program. And she said, you know, she knew something was really wrong when she'd send these folks out to go into the home to talk to families. And the goal of this project, it's called the Fussy Baby Network, is something that she ran. And the goal of the project was to stop shaken baby syndrome. So if you had a really colicky baby, the infant mental health person would really help support the parents in, you know, strategies to deal with that, in safer ways to take a little break from the baby when they were crying, all of those kinds of things. But the idea was to stop shaken baby syndrome. So you can imagine, I don't know how many of you are parents and how many of you have been up all night, many nights in a row with a crying infant, but I have been. And so what those young social workers weren't prepared for is what they heard when they met the parents, right? So my baby hates me. I hate my baby. I shouldn't have had this baby. I wish the real parents would come because I shouldn't be the real parent. I can't do this. So these social workers would come back to Linda with eyes this big and say, I don't know if I'm supposed to be doing this work. I didn't know what to say. I was so worried for them, or I feel so sad and I didn't know what to say, et cetera, right? So she kind of developed this model called the FAN to help the staff figure out how to maintain their grounding, their ability to be present, their ability to take care of themselves in real time in complicated situations. So she gave Futures permission to use this because what do we work on? We work on intrapartner violence and trauma and adverse childhood experiences and, you know, sort of trauma soup. And we knew that we wanted to double down and invest in how can we help the staff in all these different configurations, support them in being more grounded in the work. So the FAN has, you can see on the top, there's calming, feeling, thinking, doing, reflecting. We are only going to be looking at the first wedge, which is called mindful self-regulation, and looking at how we can use this theory of attunement to help ourselves and work with our colleagues to better support ourselves doing the work. So I want you to think about a time when you felt someone really got you, they truly understood you, that best friend, that partner. Who is it and how do they show they got you? And you can share out if you'd like, or you can do it in the chat. Who's your person? And how do they show it? How do you know they got you? How do they show it? So mine is, yeah, I figured people were typing. Calls just to say hello from friends, no reason but to connect. Nice. Just by listening and not judging. So Barbara, you get the gold star. It's that no cape needed. By just hearing me all the way through, right? That exercise we just did is exactly what we're all craving, and it builds that connection that Brene Brown talks about. It's how you feel safer, it's how you feel heard, it's how you feel cared for. And it's something that can be learned and grown upon. So I think one of the things that we know is when someone feels understood, known, not judged, the attunement that occurs creates a space where you can try new ways of interacting. So when someone feels really understood, they feel less fragmented and more coherent, right? More grounded, less scattered. And the world makes sense. Safety replaces anxiety and releases capacity. And isn't that what we want for ourselves and others? Safety and not anxiety. So the process of attunement is about seeing the world through the eyes of somebody else. And remember that whole cape thing, right? put the cape away, because your cape's not helping you see what that person's experiencing. Your cape is useful for you, feeling like you have some control in the situation, and you're maybe you think you're helping yourself with your feelings being stirred up. But I think it's really interesting, right? So especially for trauma, domestic abuse, and child abuse victims, these are the folks that may have experienced a lack of attunement from friends, families, professionals, often those who want to help the most. Why? Well, my sister's real story is why. Of course, I care so deeply about her. I don't want her to be hurt. I don't want her to have some terrible experience happen to her. I know what it's like. I'm too close to it. So that desire to fix it that we have when we're really too close to somebody is the thing that we have to put in check. So attunement starts with us. And you know, the conversation that I had with Alice, actually the dumping session, forgive me, Alice, I had with you, was me not being in touch with my feelings. I just was like, my feelings had completely taken me over, and you over, and everything around it over. You want to believe in your own capacity and be able to hold and contain yourself so that you can hold others. And I think, you know, this goes back to this idea about why does trauma-informed or healing-centered engagement as an organizational value matter, right? So we want organizations to learn how to hold and contain staff, how to promote policies and practices that support you from a system perspective, support you in your self-care so that you can hold and contain yourself. So ideally you can hold and contain the parent or the mom, birthing partner in the work, so that that person can then contain themselves and then hold the child. So how many of you have Siri on your phone or some other GPS on your phone, right? How many of you have dumped Siri more than once? And perhaps replaced her voice with a man from New Zealand, who's on my phone right now. Somehow I just like him better. If you think about what your GPS says to you when you make a wrong turn, what does it say? It says recalculating, right? What does yours say, Alice? Does it have a different word?
Rerouting.
Rerouting, right? Well, you know, the fan is not about being a perfect person. The fan is just about regrouping and figuring out how to take the right turn the next time, if that makes sense. And I'll give you an example of this. So you remember I told you I have 4 children. I am a grandmother and I have an 8-year-old granddaughter. So I have a lot of people in my life. There's 18 years between my oldest and my youngest is 13. So I wish I could tell you that my easiest child was my youngest child because I was tired by the time I had her, but that would be not true. Eva is the only one of my 4 kids that we had to put plexiglass on all the windows because she figured out when she was 18 months old how to crawl up into the little breakfast bar area, push open these old windows, and like was straddling that between a 5-foot drop on brick and the kitchen table that she was going to crack her head open on. So true story. So Eva was not easy. She was always in motion. And my mom sent Eva a dress that was a special party dress, and we were going to wear it for the first time. So it was a white dress with hot pink polka dots on it. And I should have known something was wrong when I walked in her room and she was quietly sitting on her bed, because that wasn't something that never happened in our house. So I'm saying, Eva, get your shoes on, we got to go, we're running late, and so I hear this little voice and I see the little shoulder shrugs, and I knew I wasn't supposed to do it. And I won't do it again, but I really just wanted to have it with me always. Always I wanted to have it. And I said, Eva, come on, we got to get your shoes on. No. She stands up. And right in the middle of her pink polka dotted dress, she had perfectly cut out one of those polka dots, the one at her crotch, and she was holding it in her hand. She cut it out with a pair of scissors. I wish I could tell you that I was my sage and wise self in that moment, and I did not yell, but that would not be a true story. I said, Eva Levinson, what did you just do? Grab a tip. So she burst into tears because I'm 5'9" tall and I probably have heels on. So now I'm a monster giant screaming thing, right, at this little teeny person. And so then I start to cry because I feel badly, and I get down really low and I said, oh my gosh, Eva, I messed up. I should not have yelled at you. I'm so sorry. And you know what? You told me everything I needed to know. You said you knew you weren't supposed to do it. You said you wouldn't do it again. And I didn't listen. And I'm really sorry. And you have every reason to cry because that was terrible. Nobody should yell at you. So I washed her face, we changed her dress, and we went on. So the idea is not that you aren't going to mess up, but the idea is you're going to catch yourself and then demonstrate that you're trustworthy in the way that you come back. So this is going to be true in all your relationships in your life, with your partner, your children, a client, a colleague, right? So when you do something that doesn't work, you have an opportunity to learn something and grow closer. And that's really what this is all about. So again, I'm going to ask y'all to get a piece of paper, and we're going to do one other exercise. And this one is a good one. I'll show you up here. So this is a good one to do in a Post-it. So what you're going to do is you're going to write what you're like when you're balanced and regulated on one side of the Post-it, and then on the other side, or you can use a regular piece of paper, but on the other side, make sure there's a side 1 and a side 2, or rip 2 pieces off so you have 2 squares to kind of work with. So on one side, using adjectives, you're going to write, what am I like when I'm balanced and regulated, and in your body? So what does it feel like in your body? Just take a second and really think about, head to toe, what are you like in your feelings, thoughts, and behavior when you're in a good place? And you're going to flip the piece of paper over, and then you're going to write down, what are you like when you're not in a good place? Where do you notice that in your body? What feelings do you notice in your body? Thoughts, behaviors. So I'm going to give you just a couple minutes to do that exercise. And if you have questions, please put them in the chat. Why did I ask you to do this exercise? What do you think? What was my intention here? Self-reflection. I don't think we take the time. Remember, I've talked about how there's just no time to be present. Until I did this exercise myself, I couldn't have told you my foot was the problem because I hadn't thought about it at all. I hadn't been present with it. Pay more attention to self, mindfulness, exactly. So what we're talking about is the ABCs of mindful self-regulation, right? So we have to have that awareness. And I wanted you to have that list of what you're like when you're dysregulated, so you can come back into balance and connect. And we're going to just talk about a couple examples of how to come back into balance. So breathing, and let's just do this together. I'm going to ask you to take a deep breath in, and you put your fingers on your shoulders. You're going to put your arms up in the air, and we're going to do it for 4 seconds. So deep breath in and hold and blow it out. Deep breath in and hold and blow it out. One more time, deep breath in and out. Now, obviously, I'm not going to say, so Alice, the next time you're dysregulated and someone you're working with, a client, a colleague, you're going to say, excuse me, I need to breathe really quick. No. But I am going to suggest that there's a really simple way to get yourself grounded, whether you're on Zoom or in person, that's really simple, and the person in front of you would never know what you were doing, okay? So what I'm going to ask you to do is uncross your legs and sit forward in your chair. And I want you to feel the floor. I want you to feel your balls of the feet, your feet on the floor, and your heels on the floor. So my friends who are shorter, scooch forward until you feel your feet on the floor fully. And then I want you to take your hands and I want you to put them on your knees, and you're going to rub your knees really quick. And just take a deep breath in and blow it out. the person in front of you just saw you change positions. They have no idea that this is a really great grounding mechanism. The other grounding exercise that I really love is this one. So if you go back to home visits or you go back to clinical care and you're seeing patients in rooms, mommies in rooms, birthing folks in rooms, I am here to listen. So in research with pediatric residents, what they found is that when they use this technique from one patient visit to the next patient visit, they're able to sort of let go of what just happened, remind themselves to be present, come in with that demeanor, and their client satisfaction scores go up and they feel less stressed. Two other strategies. One is self-talk. I don't know how many of you do this, but I am without apology a self-talker. So my self-talk is, you got this, you got this, you got this, even when I absolutely don't, as a way to kind of stay in it. You see here, #stay. Some people, prayer is really important for them. And this is a, sort of a repeating prayer, a repeating wish. That can be really grounding for folks. And then the last one is imagery. So some people kind of, if they can go to a new place in their head, they can shift out of, get grounded, right? So let's say it's a picture of your dog that's in your head, or your child, or my friend in Vermont, maybe it's a beautiful, snowy, crisp day. Maybe it's something like a field of wheat. So I had a nurse in Oregon who talked about, she'd feel the stress coming on, she'd feel dysregulated, and she'd feel like it was the wind, and the wind was the dysregulation that was pushing down the wheat, and the wind would pass, and the wheat comes back up, and it's just fine. So somehow seeing the thing that's hard, letting it go, and then recovery was a really important thing to think about. And I saw there was a couple things in the chat, so I just want to double check. Relaxation and self-care. Petting my dogs grounds me every time. I think dogs, I wish everybody could have a dog. I'm so crazy about my dog. I just got this Apple Watch and I had to get credit. Oh, nice. I love that. So those are 4 strategies. We're going to do one more written exercise, and I think this will be interesting for you all too. So again, new sticky, and each one of these questions gets its own sticky or piece of paper if you want to rip something up. So write down 3 good things about a coworker, and I just want think about one person. Don't think about everybody that you work with, one person. It could be personal or professional. If you can't think of anything, that's okay. You can leave it blank. 3 good things about your most recent client. If you are a supervisor, 3 good things about someone you supervise. And then number 3 is 3 good things about you. So just take a second, just using adjectives. 3 good things coworker, 3 good things client or staff person if you're a supervisor, and then 3 good things about yourself. Right, as folks are finishing up their list, can anyone share with me the 3 good things they said about a coworker? And you can unmute yourself or you can type it in the chat, whichever you prefer. 3 good things about a coworker. dedicated, hardworking, caring, supportive, kind, thankful, supportive, gets me out of my headspace, funny. Did anybody write a list, caring, sensitive, thorough? Did anybody write about somebody else that they know on this Zoom call that they'd be willing to share what they wrote? That like Alice, if I were to say something, oh, I can do Alice actually. Alice, you are a colleague. And so what I see in you is patience. I see absolute kindness. And I see a desire to make meaning that I really admire. So Alice, how did that make you feel?
Made me feel great. Made me kind of tear up a little bit, actually. It's so nice to hear. Thank you.
Well, so here's the thing, right? So for anybody else on this call who did it about somebody else, you can imagine the power of those words, right? So Alice, if we were together, I would write those words down and I would give you the sticky. That would be your sticky to take home with you. I bet if I asked all of you, what was the hardest one to do? It would be the stuff about yourself. That's the hardest one to do. But do you see the power of this exercise? So Alice, you now have 3 things about yourself that you can look at and consider to put on your own list because it came from me. So one thing that we're talking to sites about nationally is the power of the positive, and thinking about doing this even in Zoom, like again, part of your ritual during the week. How cool would it be to wake up and get an email or text saying, I just want to say you're this, this, and this. I also want to talk about those postcards I started out with today when I was saying about innovation. So as a result of this exercise, that home visitor got the idea to write down 3 good things about their client, things they admired, personal, about their parenting, whatever. And that's what she wrote on the postcard. And even though we say those things, it matters when it's written down, because somehow we lose the good things when we're really hard on ourselves. But the concrete helps us hold on to it in a tangible way. So I'm going to encourage you to think about, especially for survivors of trauma, intimate partner violence, and how power and control is showing up and how folks are taking other people's connection to others away through COVID and their phones. You might be the only person that person talks to. So thinking about integrating those 3 good things into what you're doing with your families is going to have so much meaning to them. And I also think for you. So thank you for doing that exercise with me. If you have not had training on the fan, there is virtual training happening. I can't say enough about this model. I mean, I gave you just a tiny snippet. You can see how valuable it might be to think about how you can keep growing your attunement skills across all the work, case management that you're doing with the families that you're serving. So I wanted to make sure you had that information if you were interested, because I know online learning is happening. And then I'm going to leave you with this one. We're not going to do it together because I think we've done enough exercises, but one thing to think about doing just for yourself after this or sometime later this week is this gratitude exercise. So the idea is you have to think of someone who's alive, who you never fully thanked for something extraordinary they did for you. They were just the right person at the right time. They said the right thing. They were kind in the right way. They were loving in the right way, whatever. But you've never said thank you fully. And just write a text, write an email, whatever. You don't have to send it, but just write it out. And what I can tell you is that what we've learned about gratitude is that when you're thinking about how kind that person was, how sweet they were to you, how helpful, how thoughtful, how meaningful, it helps you. I mean, sure, it would be nice to receive something like that, Alice. You liked hearing nice things, right? We all do. That helps us. But in fact, that gratitude exercise turns on all of your healing-centered engagement for yourself and makes you feel really good. So we know that when folks can do a gratitude journal or do sort of an ongoing exercise is helpful. So I'm just going to leave you with this. It's very brief. Something to think about doing. It's something you could bring to your next staff meeting and do it together and talk about it. There are a lot more resources around supporting staff. So all of these slides will be made available to you so you can use the slides to pull those links. And I know that Alice will also be sending out the edited Zoom webinar to all of you so you can refer back to it or share it with others. Okay, we're gonna do one more mindful movement. Once you wrap your arms around yourself, left hand over right arm, rub your arm to the other side, switch arms, stretch your hands in the air, wiggle your fingers, shake your hands, come back to center. I am grateful to each of you for what you do. And thank you so much for spending time with me today.